name is Ross Wilson. I'm a veterinarian and I work for Plasvac. Equiplas, Foal's best start. Plasma transfusions are given for a number of reasons, the main one of which is if the foal doesn't get enough antibodies from the mother's milk. That's called failure of passive transfer. A foal suffering from failure of passive transfer will have no resistance to infection for the first 2 months of its life, at which time the foal will finally become immune competent. The problem with foals with failure of passive transfer is they will get all sorts of illnesses during the first 2 months. They'll get diarrhoea, they'll get pneumonias, they'll get naval infections. And these are all cause problems that have to be treated by a veterinarian and that can cost a lot of money. If you just give the foal, check the foal's gamma globulin or antibody levels with a gamma check. If the levels are low, you can then give a plasma transfusion. You'll save a lot of this hassle during the first 2 months of life. A lot of stud owners, regardless of whether the foal has low antibodies or not, are giving a bag of plasma to their foal anyway. And all this is doing is absolutely assuring that the foal has the best health. This is what we call foal's best start. And there's all sorts of handy hints at our website named foalsbeststart.com. Details on various foalhood diseases, use of plasma, diagnosis of conditions and failure of passive transfer. So all of this is available on that site, and this video will also be available on that site. You can note here that the foal is quite relaxed, no sign of any reaction. In fact, I think the foal's asleep, and that's pretty normal for a plasma transfusion. You can see the foal is still very, very relaxed. In fact, I think he's enjoying the whole process. Awake at the moment. But it's best obviously not to fiddle with the foal. Just some gentle restraint like we're doing right now is just perfect. This also has a possible effect of imprinting the foal, getting it used to close handling by humans. Is never a bad thing in these first 24 hours of life. The most common causes for reaction are, and they're not very common at all, allergic reactions. About 1 in 100 foals may get an allergic reaction, and the signs of that will be skin wheals or urticaria, maybe some edema around the eyes or the ear, and that would mean you'd have to administer some antihistamines. Additionally, the allergic reaction, about 1 in 1,000 foals, can be more severe, possibly anaphylactic. That means that urgent treatment with antihistamines, corticosteroids and adrenaline could be needed. Thirdly, if the foal is trembling a lot, that can just mean that the anticoagulant in the plasma has reacted with free calcium ions in the bloodstream and is causing a hypocalcemia, a little bit like milk fever in a cow. And this can cause interference with the action of the heart, and it can also cause this trembling. So all you need to do if that happens is to slow the rate of transfusion if the foal starts to tremble. So there are 3 main reactions. The other source of a reaction will be embolism, and that's a blocked blood vessel caused by a fibrin particle, and you'll only get that if you do not use a filtered giving set. And that can be fatal because the blood vessel that usually gets blocked is either in the lungs or the brain. And that foal will die very, very quickly and there'll be nothing you can do about it. And it's an extremely serious breach of our administration protocol for this product. When foals get too big to handle, say for their second transfusion of Equiplas R at a month of age, the transfusion is usually done with the foal standing, and the vet will probably use a bit of sedation. He may use these jugular veins either side of the neck, or he can use some metacarpal veins on the foreleg here where I'm pointing. Either way, the transfusion is quite easy. The metacarpal veins run down the inside of the leg here, and they're quite easy to find. Foals at a month of age can be quite sensitive around the head, and quite silly around the head in fact. So they resent you going to their jugular vein to insert the catheter. They also have a memory of the first transfusion, possibly. So all in all, the second transfusion can be a bit more trouble, but nothing that a small dose of some sort of a sedative won't fix. The other thing you can do if you're impatient to get on with your farm work is you can actually bandage this swab in place and take it off in a few hours. But the foal usually resents that, so I'm just going to press on this for a little while longer. So the three important health things in the first 24 hours for a foal: you want to make sure the foal has lost its meconium, or the feces that it was born with in its rectum. That stuff is very hard. And the best trigger for losing the meconium is for the foal to have a suck. If a foal has retained all its meconium, it probably hasn't had a suck. The second thing is to make sure the navel is nice and clean and there's no hernias. And the third thing is to make sure that the antibody levels are right. How do we do that? With a gamma check. Just recapping, we use a gamma, we test the blood with a gamma check, and then if there's not enough antibodies in the bloodstream, we give a plasma transfusion. Straight to the oven. Equiplas, foal's best start.